Hi, good morning.
Hi.
How are you doing?
I'm doing good. How are you?
Doing well. Thank you for coming in today to our clinic.
Mhm.
My name is Perri Leaphart. You can call me Perri. I am a social worker here, and I will be doing it's just an assessment.
Mhm.
So can you do me a favor and verify your name and date of birth?
My name is Gabby Leggington, and it's 11/11/2000.
11/11/2000. Okay.
Pretty simple.
All right. I have the stuff we'll be going over on my computer, but it is
Mhm.
also mirrored up here for you. If you see anything on here that I'm typing and it is like either incorrect or you would want to go over it, just let me know, okay?
Cool.
So what would you like to be called during this assessment today?
Gabby's fine.
Gabby? Okay,
Yeah.
awesome. Thank you. So the point of today's session is, like I said, it's just an assessment.
Mhm.
We're trying to get as much information as possible in a condensed setting. It's a lot of really direct questions,
Mhm.
and it is just set up so that your therapist or counselor knows how to best treat you.
Cool.
Okay?
That works.
You have any questions so far?
Mm-mm.
Okay. So today's session is going to be about an hour long. Is that
Mhm.
okay? You got that?
That's perfect. I have somewhere to be right at
Okay.
an hour, so I'll be good.
Awesome. Okay. So to start off, have you ever had therapy before?
When I was younger, I did,
Okay.
but it was like when I was in like elementary school. But
Okay.
besides that, I haven't been to therapy again.
Okay, awesome. So I'm going to go over some of your informed consents and confidentiality. I'm sure you filled them out in the lobby, but just to go over them again. So everything that is said in this room stays in this room.
Mhm.
It is between you and I. And the limits of that are like if you ever alluded to wanting, to harm yourself or harm another person, kill
Mhm.
yourself or kill another person, or if there was any neglect or abuse of another person in your home.
Cool.
Awesome. So, Gabby, tell me, are you active duty, civilian?
I'm active duty right now. I recently just joined the nursing graduate program.
Oh,
Yeah.
okay, awesome.
Yeah.
Big achievement here. Okay, so I'm going to go over one other document
Mhm.
as far as confidentiality goes. So, because you are active duty, again, we went over the safety parts, threaten to harm yourself or harm another, and abuse. Also, though, if you're ever pulled in for legal things like UCMJ, your records from the session could be requested.
Okay.
Okay. Another thing is, according to the DOTI 6490.08, your healthcare providers can notify commanders if there's any like substance abuse or treatment that has to go on with that.
Okay, that's
Okay.
fine.
And then if there is treatment for substance abuse, your chain of command has to know like the treatment that you are going to be getting. Okay.
Yeah, that's fine.
You're not command directed, right? Okay.
Nope.
Awesome.
Just walking in myself.
Okay. So another thing is care coordination. So if for some reason you and your therapist, you need to have changed therapist or you need to see another provider for some reason, then you might we might have to transfer your documents over from our session so that they can review them.
So they can just see like what we did and everything.
Right, because this assessment today is, like I said, it's just generally to paint a picture of what's going on so that we can best help you.
Cool.
Okay.
That works out.
Awesome.
I don't mind that at all.
Another thing is that if your commander for some reason wanted to know if you were here, we don't have to tell them what we're going over, but we would have to tell them for like accountability purposes.
Okay. Yeah, that's fine. I don't really mind that at all.
Okay, and there's only two more. If for some reason you decided you wanted to go to some military school, wanted to be a drill sergeant or something like that, they can request behavioral health records just to see, because sometimes those schools aren't necessarily allowed for things like that.
Yeah.
Okay.
Gotcha.
And the last one, if there is a sexual assault reported either on your part or some other, it could be released to the sexual assault coordinator.
Okay, I didn't know that.
Yeah. Are there any questions about this? I know that's a lot of information.
Nah, it was on the, I think it was in like the little paper you gave me before we came in. So yeah, I'm fine.
Okay. All right. So my expectations today are that we will be, like I said, it's gonna be a lot of questions. So at any point that you are uncomfortable or you need to take a break, you just let me know.
Okay. That's fine.
Or if we're going too fast or you feel like you're not being heard or something like that, just tell me. We can take a pause. Does that sound okay? Okay. My expectations of you are that everything I just said. I'm sorry. What are your expectations of me during this session? Do you have any?
Not really. I just came in and just want to see what resources I can get. You know?
Okay. Sounds like a good idea. So after today's assessment, you will be seen by a counselor here at our clinic, and it will go on about a session about once a week for like maybe 8 to 10 weeks. Is that something you think you can manage?
10 weeks is kind of steep. I think I can do 6 to 8, but yeah.
Okay, we can talk to the counselors here and things like that and see what.
Okay. Yeah, I got a busy graduate schedule, so I don't know what's going to look like.
Of course. All right, so now I'm just going to jump in with some of these questions. I know you said your birthday was 11/11/2000. How old are you right now? So, 24?
Yes.
All right.
24.
Look at me, math. Okay, and what is your marital status?
I am currently single.
Single. Any divorces or anything like that? No?
Nope.
Okay.
Just some failed relationships.
All right. What do you say your ethnicity is?
I am African American.
Awesome. And you did say that you were not self-referred. Were you referred by anyone, or you were self-referred? Were you referred by anyone else?
No, I just talked to one of my battle buddies, and she just recommended. She was like, "Hey, why don't you just go see behavioral health for this?" So
okay.
And I've seen counseling in the past before, so okay. I didn't know where because I just got here, and so I was like, they recommended me come here, so I'm here.
Okay, so from like a friend, but mostly self-referred. Okay, yeah, no big deal. All right, so tell me a little bit about why you were here today.
So I've been having coming into this place and this environment. I was prior service before, but now I just transitioned to a graduate program, and so I know I've been having trouble concentrating, and I know I'm gonna have more trouble doing that. It happened when I was in childhood too, where I just couldn't concentrate on work, and just completing tasks were like such a chore to me, and I just had difficulty concentrating. Before this, I was active duty still, and I did stuff with my hands a lot. And so now I'm going to a place where I'm going to have to like sit and do work and focus on like the lectures and stuff.
Oh,
and
like
that's
like setting.
Yeah, I'm going to be in a class setting, and I love nursing. It's great.
Yeah.
But I know it's going to be a challenge for me. And I started it recently, and I'm noticing these challenges are coming up again.
Okay. So I just want to make sure I understood everything. So before this, you were active duty still, but you were doing a more hands-on job.
Yeah.
Yeah. So you were doing more, it was like less sitting down, listening to someone speak.
Yeah, and I felt like I was really accomplishing everything, and now like I'm about 2 months into this graduate program, and I just feel like I'm like failing at life because I'm passing, but barely, if that makes sense.
Okay.
And it's just hard to concentrate on the work, and I see other people getting in, and I'm just not picking it up as easy as they are.
And it's got to do a lot with like your concentration.
Yeah, it's definitely concentration, and just sometimes I get so overwhelmed to where I just like procrastinate because it just feels so overwhelming to do schoolwork. And so, yeah, that's just been a big problem. And I feel like if I don't pass, of course, with the military, they're going to like put me in another MOS, and I don't want that to happen. And so I'm just nervous, and I feel like I'm just failing.
Yeah, that's a lot. I mean, it sounds like you got a lot of weight on your shoulders right now.
Yeah.
The weight of passing, and then just doing well in general, right?
Yeah, I really have a high achievement. I like a high view of myself, and I want to achieve, but I just...
Okay. So tell me a little bit about if this problem was fixed, how exactly would you know it was fixed?
I feel like my grades would be going up, and I'll be able to complete these tasks in a timely manner, because I feel like I'm just like rushing myself,
Okay.
Like it's just like the last minute I'm crashing and I'm getting this assignment done, but it's not good quality,
Yeah, I understand. So you feel like because of this issue with not being able to concentrate, the stress is just more, and so now you're procrastinating more task, which is just adding more stress, which is like a revolving door.
It is, because it's like there's just no end to it. And then like again, it's not like I'm in the civilian sector to where it's like, oh, you're paying for this, you can just retake it. I can't retake it because it's just an accelerated program. So I've just been like, it's been a lot, and I love nursing, but I need to pass because I feel like I'm just gonna like fail, and my life's over at that point. So
yeah, that is a lot of weight to carry. So I'm just going to ask you a couple of questions about like some symptoms you may be having. You can just tell me that if this sounds familiar. If not, that's fine.
Yeah.
Do you feel like you've had any like compulsion behaviors where you can't refrain from doing something?
No, not so much. Like,
Has it been affecting your sleep at all?
Yeah, when I procrastinate, I feel like I wait till last minute. I'm up till like 3 a.m. trying to finish an assignment. But yeah, and sometimes I worry a lot, and I just kind of like stay up.
Okay. So you're staying up because of the worry.
Yeah, and mostly it's the assignments, but sometimes it's the worry also.
Okay. Okay. So would you say that you're experiencing any kind of like anxiety or panic attacks or anything like that?
Yeah, I would. How would you? I don't think I've ever experienced anxiety before, so I don't know what that looks like.
So anxiety is like intense worry where you just can't escape it. A lot of people like describe it as feeling it in their chest or they're shaky and things like that.
I think I feel it, like my heart starts beating really fast. So
okay. So you feel it in your chest, your heart's beating fast. And how often do you say that occurs?
Maybe a couple times a week.
A couple times a week?
Yeah, it's not like every day. But yeah, a couple times a week is when I feel like I can't grasp the concepts that they're teaching us. Because nursing school is really hard. That's when I feel like, oh yeah, like it's like that impending doom.
Oh, like, yeah. So how, like on a scale of 1 to 10, 1 being hardly none at all and 10 being like the worst that you have felt, when this is happening during the week, how bad does it get?
Probably like a 7. Like it's not like a 5 to where it's like, oh, it could go either way. It's like a 7. I know it's very noticeable, and it feels like I can't like get anything done anymore. And then like it passes, and I'll go do some work.
Okay. And then for the sleep, the issues you're having with sleep, sorry, I know I'm jumping back and forth here.
No, you're good. You're totally good.
For the sleep, about how many hours a night are you getting of sleep?
Oof, that's a great question. Are you talking about like on a school night?
Maybe? Just average, whatever you think. I mean,
maybe around like 5 hours, 5 to 6 hours. On a good day, 6 hours.
Okay, and is that uninterrupted sleep or is?
Yeah, once I get to sleep, I'm going to sleep.
So you don't have any troubles getting to sleep?
No, like, well, I have troubles getting to sleep, but I have trouble don't have trouble getting to sleep, but I have trouble. Wait, it's backwards.
Yeah, you got it.
I don't have trouble staying asleep, but I have trouble getting to sleep. Yes.
Okay.
Sorry, I'm
all good.
Concentration again. It's the concentration. I don't even know. I don't know.
I understand. That's fine. We're working together here. So, and then this trouble with sleep, about when did it start?
Right before I got here, I feel like it started because
got to the program.
Yeah.
Okay.
Because I think like I realized like, oh crap, you're gonna be going back to school. You haven't been back to school in years, so yeah.
Okay, and this is just about every night or only on school nights?
Nah, it's it's only on like school nights. It got worse when I got here, but it's still not every night, but it's gotten like 4 to 5 times a night rather than like maybe like 2 or 3 times before I got here.
Oh, okay. So you're saying like before you got to this program, you might have had 2 or 3 nights where you were having trouble getting to sleep. But since you've started the program, it's now closer to 4 or 5 nights since. Okay.
Perfect. That is exactly what it is.
A week. Okay. And then, are you having any nightmares associated with that at all?
No.
Awesome. And then back to the anxiety portion. So I see that you said that it's happening a couple of times a week. It's about a 7. How long are these feelings lasting?
I don't know an exact time period, but I know like after I like take some deep breaths, I'll call my mom or my best friend, and then after that they go away. Okay.
And when did you start feeling this anxiety?
Probably like before I got here.
Okay, so before the program, or?
It was right before the program when I knew I got accepted to the program. That's when I started feeling it a little more.
Okay. And over the time, so started feeling some anxiety around the time you got accepted. How has it changed since you've gotten here?
Well, it's gotten worse. I think it's gotten worse due to just like the caseload, and I feel like I'm like failing at literally everything, and so it's like it keeps me up a little bit, and like during the day, yeah, it's tough.
Okay. I'm gonna put a pin in these. We'll probably come back to them.
Okay, that's cool.
Do you have any pain, chronic pain, as of right now?
No, I don't have any pain. I'm pretty healthy.
Are you feeling any agitation or irritability? Okay.
Nah.
And you did talk about some concentration and focus problems. Tell me a little bit about, I know you kind of mentioned it at the beginning when I was asking why you wanted to come in today. Tell me about how often you're having these concentration problems.
Oh, this is like every day.
Every day?
Every day. It's like, it's so hard to like start stuff. And like, because I feel like I just can't grasp the concept, and my brain is going miles a minute, and like little things just distract me.
Okay.
And so it's hard to just concentrate.
Sorry, I'm just trying to make sure I got all these
No,
notes.
you're good.
And about how long is it lasting when you feel like you can't concentrate? Is it something that you can like take a break and come back to, or how long does it feel like you're not able to concentrate for?
It goes on, it like ebbs and flows throughout the day, so it's not just like one specific time. It's just like this environment being back in like a college setting and like academic setting, it's just like persistent.
So it's like every task that you're having?
Yeah, pretty much. Yeah.
Okay.
So it's like, it's all day basically.
Okay. And then I know you mentioned you had some concentration problems in the past, right?
Yeah, when I was a kid, I had some problems and my mom put me on some medication. But that's what I went to go see a therapist for too.
Okay. And were those concentration problems, what were they in relation to?
Academic.
Okay.
Yeah. I just couldn't, I felt like when I was in school, I couldn't sit still. And my mom noticed, like, your grades are tanking, but you're, like, smart. You're getting your stuff done. And my mom's therapist, so she's like.
Oh, so she's on it.
Yeah, she's on it. She's on it. So, but I just, like, I don't know. It got to a point where she couldn't manage it anymore. And so we went to go get help.
Okay.
So.
Do you know about how old you were when that happened?
Ooh, that's a great question. It was somewhere in elementary school. Okay, like, I think I was like maybe like 9 or 10.
Yeah, that's fine. Elementary school age is absolutely
fine. I don't remember all that stuff.
Do you know what medication you were taking?
That's a great question also. I have no idea.
No problem. And then let me just okay. And then you're just seeing those problems arise more frequently.
Yeah, I knew they were kind of always in like the back of my head, but like I mean, when you do stuff with your hands, it's just like you just kind of get in the rhythm.
It's a different type, right?
Yeah, and like my brain shuts off, and I like can just like do things. But like when you're like sitting down and you're in one place, it's like, oh crap, like I have to sit still down.
Yeah, I definitely get it. So, are you having any memory problems at all?
I don't remember stuff. I don't remember stuff. Like when I go into like class and they tell me X, Y, Z, and it's nursing school, so it's like you have to remember stuff. It's people's lives. So some stuff like I'll grasp, but I have to like intensely concentrate. And so I just don't feel like I'm grasping that. But besides that, like if you're talking like outside of that, like my memory's not too bad.
Okay, so it's mostly focused around school. Is that what I'm hearing?
Yeah.
Okay. And did you always have memory problems, or is this just something that is started appearing while you're at school?
Mostly at school. Like I feel like I get overwhelmed and I just like forget. Or in general, I just forget. Like the pressure of academia is like it gets really tough on me, so I just don't remember certain things.
Yeah. Do you have any eating concerns right now?
Oh no, I eat very well.
Oh, awesome.
I love food.
Me too. Okay. I know we did talk a little bit about your history of the concentration issues that you were having. And it looks like, so you you had some concentration problems when you were in school when you were younger, and you were medicated for that, and it worked.
Yeah.
And then now that you're back in a school type of setting, you're having those problems again, right?
Yeah.
Okay. Let's see. And were you ever hospitalized for anything?
No.
Okay.
I was a good kid mostly.
Okay.
I talk too much, but that's about it.
Yeah, I feel that. How has this concentration issue been affecting like your energy levels?
It's been okay. My energy levels have been okay. They're usually kind of heightened sometimes. Like I just can't like sit still, or when I get anxiety, it's like I have to move and fidget around. So overall, I think my energy has been fine. It's just I get overwhelmed a little bit.
Okay. If you ever see something up there that is like, that's not what I said, just
dang,
please.
I forgot about that. Nice.
Yep.
New technology.
And how has the concentration issues affecting your, I mean, I know you're in school. I said it's like kind of a work setting type of thing. You said your grades are dropping some.
Yeah, it's just like I keep like, cause like for nursing you have these kind of like practical things where you have to like do like a lab or like simulate something with the patient. It feels like I make like little careless mistakes.
Okay.
And I don't know it at the time, but when I look back, I'm like, oh yeah, I knew what to do. I just
and that's frustrating.
Yeah, very. Because I know I knew what to do at that time. Or if I didn't, I didn't know. But like I just make these stupid mistakes.
And if you feel like if your concentration was better, you wouldn't be making those mistakes.
I would be paying attention to the little things, but like I just don't. So
yeah. Sorry. Okay. And how is it affecting your relationships, the concentration issues?
Not really as much. My friends see I'm stressed, but besides that, they're really supportive. I have a really good group of friends here, and they recommended me to come here. We're kind of just all in this together, like High School Musical.
Okay.
Yeah.
But other than that, it doesn't really affect them.
No.
Okay. And that can mean, when I say relationships, that can also mean like your relationships at home. And you said you're single, so you have no significant other or anything.
Yeah, I just got a dog.
Oh, well, that's also a relationship. So if it's affecting that relationship,
oh yeah, no, my dog loves that I have energy.
Okay.
He's like, yes, let's go, let's run.
Yeah.
So
all right. So we talked about your sleep and appetite just a little bit. So your friends say you're stressed. How else has anyone else like noticed this concern? How has it been perceived as a problem?
My professors see like they know that like I'm passionate and I love what I do, and they know it's not like because I'm lazy or whatever. And they've mentioned that they're like, we know it's not because you don't lack the motivation, you don't want to help. It's just like I can't focus, like I'm not grasping the concepts, or I'm like turning assignments in late and stuff like that. And they've been very supportive of me, but they've brought it up that it's just like they're like, this isn't like you.
Yeah.
So yeah.
You said your professor said this isn't like you.
Yeah. They know like I'm not lazy, and so they're like, we want to assume the best. Like
it sounds like they are looking out for your best interest.
Yeah, they really are. I mean, we're only like 20 people, so yeah, we're very very small. So they notice a lot.
I think that's a benefit.
Absolutely.
Okay. Have you made any attempts to cope with this or address this concentration?
I mean, I'll put on like background music and when I try to study, or like the concentration, or like the brown noise or the white noise, but it hasn't helped. I mean, besides the medication when I was younger, I haven't really tried anything.
Okay, so that's the only thing that you think. Yeah. And when was the last time you took that medication?
Oof. Right when I graduated high school, I stopped.
Okay.
I believe.
Okay, that's fine. I just wanted to make sure I put it in here. I wasn't sure if you were still taking it for some reason.
Yeah, because when I went in the military after, I had to stop taking it.
Okay.
So.
Okay. That makes sense. And you didn't have any problems after you stopped taking it?
Not really. I kept moving.
Yeah, but you had a job where that was
I had a job.
in a way, right?
Yeah, my bachelor's was online too, and so like when I did practical stuff, I could go do that, but
Right.
I could manage my own time and like do my classes
Yeah,
while
exactly.
I did work. So
that makes sense.
Yeah.
That so makes sense.
So I didn't really need it.
Okay. So school, you would say, is your main stressor?
Oh yeah.
Are there any other stressors in your life right now?
No, I wouldn't say that. I mean, I'm away from my parents and like some of my best friends, but that's about it.
Okay. Okay, so some of these questions are they're a little deeper. Okay,
Bring it. Let's go.
I mean, yeah. If you are again uncomfortable at any point, you just let me know. Okay. So,
Cool.
have you ever, or do you
Mhm.
now, have
Mhm.
any suicidal ideation or desire
No.
to kill yourself?
No. I love my life. My life's pretty great.
And never in your life, or okay.
Nope.
And then, have you ever wished you were dead? Like you could go to sleep and not wake up?
No.
Okay.
No, even though this has been hard, I don't. I love being alive. It's pretty fun.
Have you had any thoughts of wanting to harm yourself or another person?
No.
Or kill another person?
Oh, no.
Okay, so nothing like
No.
that. Okay, thank you. I will have to ask those again during our mental status exam.
Okay, yeah, that's fine.
It's essentially, it's called a mental status exam. All it is just make sure that we are in the same place together.
Cool.
Okay.
Hey, I'm in the nursing side. I know. I know what you're putting down.
All right. Let's see. Besides the presenting concern, are there any other emotional or behavioral concerns for this problem?
Okay. Not really.
Awesome. And then, do you have any childhood or adult experience or anything that you would call abuse?
No, my parents were very loving. I don't have any problems with that. I mean, they worked a lot, but besides that,
yeah.
Nah.
Okay. So that includes physical abuse, mental abuse, sexual abuse, family or intimate partner violence, or neglect. Nothing like that.
No, nothing like that.
Have you ever experienced discrimination or sexual harassment in any setting?
Discrimination like in schools and stuff, but besides that, like from the South.
Okay. Can you explain or just elaborate a little bit on what the discrimination? You can give me like a couple of sentences.
Just like kids poking fun of me, maybe because I look different. But yeah, besides that, it was only like a couple of years, and then.
And by saying that you look different, what exactly do you mean?
My hair, some of my clothes and stuff, or the way I talked her.
And was this ever addressed by anyone?
Yeah, my parents made it. They definitely shut that down. So.
Okay. And then after that, was there anything that ever came from that?
Yeah, I think they got in trouble, but it was
kids got in trouble?
Yeah, but it was so long ago that I'm like, I forgot what happened.
Okay. And how do you feel like that impacts you now?
It don't really impact me. I just treat everybody fairly now.
Okay.
I don't think I held on to that or anything.
So you think that, or you feel that because that was something you experienced, you don't want anyone else to experience?
Absolutely. That? I love that's why I go into nursing.
I love that. Yeah. I'm sorry you had to go through that. That is
yeah, no one deserves that.
Yeah, I agree. But I love that you took it and was able to make a great outcome of it.
Yep.
Have you ever experienced any psychiatric hospitalizations?
No.
Okay. Have you ever had any like residential placements where you had to go stay somewhere overnight? Or you said you did do therapy or counseling though?
Yeah, I did therapy when I was younger, but besides that, I didn't do any like residential programs or anything like that.
Okay, can you describe to me what kind of counseling you did, or how often it how often you seen them?
We only went a couple of times. It was just to like, I guess to get a diagnosis or to like, start the medication and stuff. I just talked to somebody and they asked about my feelings and about kind of like similar to what you're doing a little bit.
Okay. And then, so you only seen that like counselor or therapist like maybe twice?
Yeah, it's like 3 or 4 times.
Okay.
Over the month just to see like if the medication's working, if they talk to my mom a lot too. So.
And then after that, you never seen them again?
No. I had a doctor, but I didn't see the therapist.
Okay. I can't type to save my life, but that's okay.
It'd be like that.
And then you said you don't remember what that medication was.
I totally forgot.
That's fine. I just was going to put it in here in case, but if you don't remember what it is, it's been over 10 years ago that you took it.
Yeah, it was a while ago. I should know this. I don't know. I forgot what it is.
No, you're totally fine. Have you ever experienced any events that you would consider traumatic?
Not really. Me and my family got in a car accident
when
we were younger. And it was a lot. We all had injuries and stuff, but besides that.
Okay. And how do you feel like that impacted you after?
It brought our family closer.
Okay.
Yeah, it was pretty serious, but we all walked away and we all got closer during that time because it was like I broke some bones and my brother did and my sister did. Yeah, it was a lot.
Did you struggle with anything after that traumatic event? Okay.
No, I just went to physical therapy and that's about it though.
Okay. No counseling or anything for the
No.
Do you feel like anything from that event still comes back into your life now?
Not really. I mean, I don't think so.
Okay. All right. Have you ever experienced anything that you would consider significant loss?
Not really. Not that I can think of.
Okay. All right, we're going to jump into something, like I said earlier, it's called a mental status exam. All it really is we're just checking some things. Again, these are very direct questions.
Okay.
Some stuff I've already asked. I'm just going to ask it again. Okay.
That is cool.
All right. Tell me your name and where we are.
I am Gabrielle Leggington, and we are in the clinic today.
Okay. And do you know about what time it is?
It is sometime in the morning. I'd say like 8:45ish.
Okay. And why are we here?
To talk about me and to see if I can get help.
All right. Awesome. And if you could give me about 2 words to describe your current mood.
Nervous and excited.
Okay. I'm going to give you 3 words.
Mm-hmm.
I just want you to say them back to me, and then I'm going to ask you to repeat them in a little bit, okay? Chair, table, cup.
Chair, table, cup.
Awesome. Cool. Good job. And then can you tell me what elementary school you went to?
I went to Victoria Walker in Baytown, Texas.
Awesome. And then I'm going to give you 5 numbers. I just want you to repeat them back to me, okay? 0, 7, 5, 9, 2.
0, 7, 5, 9, 2.
Awesome. And then I'm going to ask you to count backwards by 5s, starting at 100 all the way to 0. You start when you're ready.
Okay. By 5s. Okay, cool. Yep. 100, 95, 90, 85, 80, 75, 70, 65, 60, 55, 50, 45, 40, 35, 30, 25, 20, yep. 15, 10, 5, 0.
Perfect. And do you remember those 3 words I told you to remember?
I'm not gonna lie to you. I totally forgot. I totally forgot.
That goes back to some of those memory things we were talking about, right?
Yes, I totally forgot those. As soon as you said it, I was like, I forgot what those are.
All good. Okay. So where do you currently live?
I currently live on post.
Okay. And who do you live with?
Just myself. And my dog. My little dog.
Okay. And how do you feel about your current living situation?
I feel good. I mean, me and my friends are right around each other. Yeah, we're all in a little group, so we're down the street from each other. Some of them have families, so we all get together.
Okay, awesome. Are there any safety issues or concerns about where you live?
No, okay. It's very safe.
And have you ever experienced loss of housing, even when you were a child till now?
Oh, no. No.
Are there any firearms in the home?
Yes, I do have firearms. I am a native Texan, so but they are locked and stored in a gun safe though, and they're registered on post.
Okay. Awesome. Perfect. And are you using any community resources? That can be food banks, public transportation. Okay.
Got my own car.
Awesome. And are there any resources that you think you may need and don't have?
Not that I know of. I guess when we as we go along in counseling. Maybe if I need some,
we can definitely talk about that, and we have people that can help you get situated with those. Are there any past or present concerns related to where you currently live or the environment that you live in?
Oh, no. I grew up in the suburbs.
Okay, awesome. You said you were single?
Yep, sadly.
Okay. And do you have any children, biological?
No.
Okay. And in your opinion, describe who you have in your support system.
I have my mom, my dad, and then I have my sister and my brother.
I know you mentioned some friends earlier as well. Would you consider them part of your?
Oh yeah, absolutely. We study like every day because we have this. It's like we have the same schedule, so we all kind of confide in each other.
How often do you talk to mom and dad?
Oof, once a week.
Once a week? Is that by phone?
Yes, we usually FaceTime.
Okay, perfect. And sister and brother?
Probably like twice a week.
Oh, okay.
Yeah, my brother, he's actually stationed here, and yeah, he's great.
That's so convenient.
It's very convenient. We don't live together, thankfully, but
yeah,
he's right down the street. So
okay. And is that so? You see him face to face?
Yeah, I see him face to face. My sister, she has another family across the country, so I don't get to see her face to face, but we call and we talk.
Okay, so you talk on the phone.
Yeah.
Okay. And are there any family stressors that you're currently experiencing?
No, my family, they're pretty good. We all are really close knit. Just my parents getting old in old age, but besides that, just regular maintenance stuff for their health and stuff. So
of course. If you could describe your childhood family in one word.
Connected.
Okay. Now describe to me what you mean by connected.
We relied on each other when we had that crash. When I was like early elementary school.
Yeah.
That kind of brought us together, and so we started to be more intentional.
Okay.
Yeah. And so it just brought us together. We just realized how precious life was. So, which I had some awesome nurses, which is why I went into nursing too. So
yeah. You said you have one sister, one brother.
One sister and one brother.
Are those older or younger?
They are older. They're both older, and so I'm the baby of the family.
Oh.
Yeah.
And where did you grow up?
I grew up in Baytown, Texas.
Oh, you did say that. I'm sorry.
No, you're good. You are totally good.
That's where you went to elementary school, right?
Yep, elementary school.
And growing up, give me one word that describes what your relationship with your mom, dad, and siblings was when you were growing up.
Busy, if that makes sense.
Okay. So you were a busy family?
Oh yeah, I mean you have 3 kids, and everyone had different extracurricular stuff, so we were running around.
Lots of extracurricular too.
Oh, absolutely.
And how were you? Did you and your brother, sister, how did y'all get along?
Oh, me and my brother, we were roughhousing, but besides that, we all got along pretty well.
Okay. And how did you get along with your parents growing up?
Yeah, we were good. I'm pretty close to my mom. My dad is my dad, so he's good. We're close too, but I'm closer to my mom.
Okay. And then, do you have any family history of medical conditions, substance abuse?
No, not I think of. My parents have high blood pressure, but that's about it. I don't think we have any history besides that.
Yeah. Okay. And then substance abuse in the family?
No. We're a Christian household, and my parents would quite literally murder me if I did drugs. So.
Okay. Was there any legal involvement?
No.
Any emotional, behavioral, or psychiatric concerns in the family?
My mom's crazy, but I'm just kidding. No, she was good. Nothing like clinically like that.
And then, was there any suicide in the family?
No.
Was there any homicide in the family?
No. Okay. Thank God. That would be awful.
And how would you describe your health throughout childhood?
It was good. That crash was kind of the biggest thing. I hit my head pretty hard. But besides that, I was pretty healthy. Besides, like, in the concentration stuff and all that fun stuff. Yeah.
And then let's talk about some of your hobbies. So, what did you do as a child?
Oh, I played basketball, volleyball. Yeah, those were my 2 really, really good ones. So,
was there any other interests or activities that you engaged in?
I read books.
Okay.
I love books.
Is there any of those that you still do today?
I have a Kindle that I read.
Okay, so let's talk a little bit about your school history.
Cool.
I know that when you were in elementary school, you had to be seen for concentration and you were given medication for that. Were there any other things that went on in school that you feel is significant? That could be moving, talents, academic achievements.
I was really good at sports. Okay. That's about it. I don't think I really had any like standout things. Besides like the academic stuff, and once I got on medication I was fine and I really excelled in school. Okay. But yeah, I was really good at sports.
Other than the concentration, were there any learning disabilities?
No, not that I can think of. It just I had to be in a separate room sometimes to do my work. But that's okay. About it.
Okay. Other than that, was there any other non-academic concerns, including like bullying? I know you said you experienced some discrimination. Other than that, was there any other things outside of school that came up? Okay.
No.
And what is your highest level? I know you said you had a bachelor's degree, right?
Yes, I do, and I'm getting my graduate degree right now.
Okay. You said you have no physical pain at this time. And how would you describe your general health?
My general health is good. I don't think I have any physical problems at all, or really, this is my only problem.
And you don't take any current medication?
No.
Okay.
Army.
Do you have any physical disabilities?
No.
Okay. So we talked a little bit about this car accident that you were involved in. So we're going to talk a little bit about history of your medical conditions, accidents, or concussions. So you said you had to see physical therapy for that.
Yeah, I broke a bone. I broke a couple bones, I think. But then like I hit my head too, and so I had a concussion during that time.
And you seen physical therapy?
Yeah.
And was there any issues in recovering?
Not that I know of. I mean, it was so long ago.
Okay.
I don't believe I have any issues.
And you said you did have a concussion during that.
Yeah, I hit my head pretty hard.
What was recovery like for that?
It was okay. I don't think there was anything stand out about that. They just kind of let it run its course, but I didn't get any like follow-up stuff for it. So.
Okay, and do you feel like that has impacted you as of today?
I don't know. It seemed like afterwards, it's kind of, now that you mentioned, it's kind of when the concentration stuff started to shift a bit. So.
Okay, you think there could be a relation between having that concussion and
possibly, but like there was a period when I was fine, and then like it was like maybe like 2 grades after that I started to. My mom like started to notice the problems and stuff.
Okay. All right. Have you had any recent weight gain, loss, more than 10 pounds, or appetite changes?
Nah, I've been steady. Okay. I love to eat.
We talked about your sleeping issues a little bit. Have you ever sought any treatment for help with sleep?
No.
I know this is random. Do you have any dental issues?
Just got them fixed.
All right.
So, nope.
So what did you have done?
I just had fillings done.
When was that?
3 days ago.
And you're up to date on all your stuff,
right?
Yeah.
Because I'm all good. Okay. I'm so good with that.
How would you describe your sexual orientation?
I am straight.
And how long have you identified as straight?
All my life. I don't think I've questioned it.
Are you currently sexually active?
No.
Okay.
I ain't got time for that.
And if you were, how do you usually go about protection?
Condoms.
Okay. Do you have any concerns with your sexual functioning?
Oh, no.
Or sexual health?
I'm pretty good.
And have you ever had any sexual experience that you would consider traumatic?
No, I don't really have sex
at
all. Like, I had a boyfriend once, but that's about it.
Okay. Are you currently using any substances?
Nope.
Do you have any history of substances?
No. Your mom would beat me.
Has there ever been any like medical, legal, or family stuff to work on drug usage?
Okay. No.
Or alcohol?
No, we didn't drink either.
Okay, so you are in the military active duty. How long have you been active duty?
I've been active duty since I got out of high school, so I would say like 10 years now.
Okay.
No, not 10 years. 6.
6 years.
Okay. Yes, 6 years.
And you're in the Army?
Yes.
Okay. And you said you're a student right now, nursing
Yes,
student.
I am.
Why did you choose to join the military?
I couldn't pay for college. College was
Okay.
so expensive. And again, you have 3 kids, so it's like,
All
and
right.
I'd rather go to the military for that than go for scholarships and stuff for sports. So.
Right. Okay. Have you ever been deployed?
No, have not been deployed yet.
Okay. And how many times have you PCS'd?
Ooh, 3 times, I believe.
Okay. And where did you go?
I went to Fort Stewart, and then I went to, I believe, JBLM.
And then now you're here.
And then I came here, yes.
Fort Sam. Okay. And what is your overall impression or attitudes about being in the service?
I love the military. It's tough now, because I have to sit in a room all day. But besides that, like it's pretty great. I have a great experience with the military. It's tough, but I can't complain.
Okay. Are there any previous concerns with your military?
Nah, I haven't had any problems.
And you didn't do anything before the military? You joined right after high school?
Yeah, joined right after high school. So I didn't work or anything like that, or just went straight in.
Okay. Have you ever had any past legal involvement? So you've never been divorced or anything like that, right?
No, never been arrested, never been divorced, nothing like that.
Okay. And do you identify as any kind of religious or spiritual?
I am a Christian.
Okay. And do you practice that in any way?
Yeah, I go to church every Sundays, and then I have like small groups that I go to during the week.
Okay. Is there anything about that you would like to be considered in your therapy here?
No, I'm okay. I get that outside of there. It's not really a pressing thing for me to have that incorporated here.
And what is your religious background or history? Like, how was that in your family?
We grew up in the church, but I recently started making my own in the last couple of years since I've been in the military.
Yep. So your parents were also religious? Would they?
Oh, absolutely.
Okay. Would they also identify as Christian?
Yeah, Southern Baptist.
All right. Okay, and what are I know you said that you did some hobbies in high school and that you like to read, and you currently still read, right?
Mm-hmm.
Are there any other interests that you have?
No, that's pretty much it. I like to be at home. I love my house. I love enjoying my rent.
Okay. And do you do anything specific for relaxation or like fun?
Probably reading a book.
Just reading,
I love
right?
reading.
Okay.
Yeah.
How would you define your culture?
My culture, in what way?
So your culture could be like your shared experience with your family and friends, your norms and values.
Oh, yeah.
Identity, anything that impacted your life.
Yeah, we're really big into like family and keeping family together. I think that's what we value most, is just keeping that relationship tight knit.
Yeah.
Just loving on each other.
Okay.
So.
Okay. Do you have any specific beliefs or traditions that are like really valuable to you?
Family probably.
Just family.
And really making friends and being close.
So like people. Having a close support network.
Yeah, I love relationships around me. They're not necessarily romantic, just like friendships and stuff.
Okay. And then, what would you see as your strengths?
Ooh, I think I make friends really well.
Okay.
I love to love on people, and I'm very motivated.
Awesome. Thank you for that. And I can also see that you're very motivated because you've seen a problem and you're here to fix it.
Thanks.
Yep. And then what are your primary ways of coping with just general life challenges?
I do a lot of deep breathing. And I try to just call people and confide in them, and especially the people that really know me.
Okay. Your friends, family and friends.
Yeah.
Okay. And what needs or purposes do you have for your care here?
I don't really have anything specific. I'm just kind of going with the flow.
Okay, that's fine.
Whatever you see fit.
And then just whatever your schedule is with your school schedule.
Yeah,
Right?
especially that's probably the biggest thing.
Okay, we can work through that. And I know we talked about a little bit about like if this problem was to end for you, what it would look like. But can you tell me a little bit about what your outcome of therapy would look like for you?
I think just managing. I think concentration thing I've dealt with, but like the anxiety of just like staying grounded and realizing it's not that big of a deal.
Yeah. Okay. So we're right here at the end. Thank you for staying with me. I know that was a lot of questions.
Yeah,
and you were great. So do you have any questions about the therapy process or what anything we went over today?
Not really. It seems very straightforward. You've been great about communicating.
Okay, so the next steps are essentially, I think individual therapy would be great for you here. So like we talked about 6 to 8 weeks, depending on what you can do on your school schedule, seen about once a week here at the clinic.
Yeah, that'd be perfect.
You'll probably be seen with me, and anything we miss here, we can just go over it then. All right, do you have any other questions?
Nope.
All right, thank you so much for coming in today. You did